Let me give you a few examples of applying these different control systems in different contexts. Think of a hospital emergency room. Now, an emergency room needs to be open round the clock, 24 hours. So, it is very unlikely that you will have your very high end doctors, the specialists, the experts always available at the emergency room. Most of the emergency rooms are actually managed by a whole bunch of paramedics and typically senior medical students. They might be called as junior residents or senior residents. Now, when a patient is brought into an emergency room, what are the control systems that we need to have at that point of time? Think about it for a while, but you will notice that the most of the stuff that you need to have there is probably a lot of rules and regulations. Rules and regulations to make sure that the person who is brought in, the patient who is brought in is stabilized, probably he or she is not having any hidden bleeding, they are having the heart rate normal, what are the vital parameters, etc. And that is what all these people are well trained to do. Once they get all the readings, then most probably they will call up the senior doctor and tell him or her that this is the state of the patient and you need to come and look at these people. So, very often you will notice that at lower levels of organization, and in this particular hospital when you look at the paramedics or when you look at the junior doctors, they are at the lower levels of the hierarchy. There is a high incidence of rules and regulations. Of course, there will be a little bit of direct supervision also coming in here. But in the same hospital, think of an operations theatre. In the operations theatre, you will have very high end surgeons coming in. Now, looking at it from a hospital administrator's perspective, what kind of control system would you have on this high end surgeons, the cardiologists, or maybe somebody who is an expert anesthetist? Because remember, one of the very interesting thing about dealing with experts is that the experts are actually knowing the job better than what you can know. That is why they are experts. And you as a manager and a leader, it is extremely difficult for you to be expert in multiple things. And yet, you have to make sure that they are doing their job. Now, in the operations theatre, obviously, there will be certain basic rules and regulations in terms of hygiene or arriving on time, patient preparation, etc. But for the top surgeon, let us assume the cardiologist, you will find that apart from culture control, there is hardly any other control that you can impose on him or her. Rules and regulations are not going to work very well. Neither can you impose output control here. Typically in operations, you might say that okay, if the patient survived, then that can be a nice output control, but I think it is very dangerous to incentivize a doctor based on the survival rate of the patient, because the patient, it is a biological phenomenon, he or she might still not recover fully because of other conditions despite all the effort that has been put by the doctor. So, the surgeon has to be highly motivated, as much motivated as everybody else in that hospital or that room to save the patient, to actually cure the illness, and hence you need a high degree of principal agent convergence at that point of time. So, as you look up the hierarchy in organizations, you will find that the rules and regulations will probably take a back seat and culture control becomes very important. In general, in the world of business, the output control will always be there, because you have to deliver services, you have to deliver products, and something or the other needs to be measured to satisfy the stakeholders, to measure your performance, etc. But you will find that this level of direct supervisions and rules and regulations are a lot at the lower levels of the hierarchy, but as you move along, often these gets replaced by culture control. Another way of looking at it is that when the job gets more and more uncertain, more in terms of how the job should be done, there rules and regulations do not have a great role to play. Neither does direct supervision. And as you become senior in organization, what you need to deliver becomes much more uncertain, especially how you are going to achieve it. Yes, you know that I have to be better than my competitor, I have to achieve X percentage market share, my share prices need to go up, but there are very different ways of doing it because the world is very uncertain there. It all depends on government regulations, maybe competitive reaction, maybe certain economic conditions, and hence there it is much more important that you have strong culture control rather than worrying too much about rules and regulations and direct supervision.